And so, Amy, thank you so much for taking the time to speak with us today about your journey. We like to start with a bit of an introduction. So, if you could tell us a little bit about yourself, who you are, where you're from, it gives folks a chance to connect to you and your journey.
Great. Thanks for having me, Manny. So my name is Amy, and I live in Tampa, Florida, and I am here to talk to you about my diagnosis with breast cancer. So I'm hoping that I'm able to help people process what those feelings are when you're first diagnosed and that journey, as we say, coming out on the other side. So I'm really excited to talk about.
That's great. And what's it like living in Tampa?
It's awesome. I'm born and raised in Florida. I couldn't live anywhere else. Tampa, as you know, we've got a lot of sports teams that are doing great. They call it Tampa Bay now. There's signs everywhere, but we're close to the beach. The weather's beautiful. We're here in December. It's supposed to be 81 is the high today, and the sun is out. So I'm a real Florida, so I love it.
Oh, that's wonderful. And I remember the commercials when I lived in Boston. A bad day in Florida is a good day anywhere else, right?
That's a good one. Exactly. I am ready for it to cool off a bit, though.
Oh, that's wonderful. That's wonderful. And your family, all your family lives in Florida?
Yes, I'm married, and my husband Frank. We've got 2 dogs and a cat. My younger sister, who I'm close with, is here in Tampa, and I have nieces and nephews that are a couple of hours south of me. So yeah, everybody's in Florida.
Oh, that is so great. That is so great that everyone's there. And, holidays are a wonderful time, is a wonderful time of the year for sure. And how has COVID treated you?
Well, when we talk about my diagnosis and treatment, COVID I've stayed away from it. Florida, we're on the news quite a bit, as you know, but I have really protected myself. But COVID, believe it or not, when we're talking, this whole situation, I think, enabled me to get through the system a bit faster than I typically would have.
Wow.
Which is unusual. Yeah.
Okay. Well, great. Well, let's go ahead and dive right in. So,
okay.
When was it and what was it that you noticed that initially got you concerned so that you would maybe want to seek some attention?
So last year in 2020, in April, right when the pandemic was starting to ramp up, one night I was getting ready for bed, and I hope you don't mind, Manny. I have to be a little bit graphic. It's breast cancer we're talking
about. No, of course.
The education. I was getting ready, and I noticed that my left nipple was inverted, and I had not noticed that before. I immediately ran into the bedroom. I said, Frank, have you noticed this? And he said, no. And I got goosebumps. I just had a bad feeling because by training, I'm a nurse practitioner, and I haven't practiced in a couple of years, but when I would do well-women visits, I would always say to my patients, if you ever notice anything different, particularly any dimpling or changes in the nipples, you want to call me right away. And my heart just dropped. I knew it was within 30 seconds. And I went back in the bathroom and I got my composure because I didn't want to upset my husband. And went to bed that night knowing I needed to get on this right away. So first thing in the morning, I jumped up, I called my OBGYN office. And like I was saying about COVID, I was able to get in right away because they were limiting the patients they were seeing. I explained, and they said, we need you in here right away. The nurse practitioner was very concerned with what she saw, got me in to have what's called a diagnostic mammogram. And what makes that different than a screening mammogram is the radiologist actually looks at the images while you're there to see if they need to do further testing. So I went the next day, had that diagnostic mammogram, and the radiologist said, we need to do an ultrasound. The technician said to me, because my husband couldn't go into the imaging center with me, she said, is somebody here with you? And I just knew when she said that. And I said, yes, my husband's in the car. And she said, do you want to go get him? And I said, I'm okay. I'll do this because I was protecting him,
Sure.
And so they did the ultrasound, and the ultrasound technician was, you think of the wand, and she's really pushing and trying to get a good picture. And she said, I'm going to get the radiologist. So he comes in very stern-faced. He's doing the ultrasound wand. And I looked up at him and I said, is it cancer? And he said, I'm 99% sure. He said, of course you need a biopsy to confirm it, but I'm 99% sure. So
and what was it about the cancer that made him so certain? What was the
characteristics of it? What ended up is the tumor is on the underside of the nipple and pulling it down, which makes sense why I saw that inverted nipple. But he said the way it looked, it's a horrific description. He said it almost looked like a crab claw pulling it down. So the visual with that is not so great. So, and he said, you need to get a biopsy right away. I felt like I was in a trance. I went and I changed. The technician's like, are you okay? I said, my husband's outside. And they said, we'll get you in for a biopsy as soon as possible. We'll call you and schedule that. So because it was April, hot outside, my husband had moved the car to park under a bunch of trees. So he parked very far away. And I was running through the parking lot trying to find him. And when I did, I was crying as I ran to the car, and he said he just knew. So that, I feel like, I can remember the day, April 9th. I feel like that just started everything. It just was all set in motion. I had a biopsy, let me think when they scheduled it. The following Monday, it was like almost immediate. That was the end of the week. And the biopsy wasn't bad. When people are watching this, they wonder about the biopsy. I hear different experiences. For me, they used a local anesthetic. They talked me through it. It really wasn't bad, and I was able to get the results the next day. They called me. Actually, one of the nurses called me. I was surprised. I was thinking a doctor would need to call me, but they confirmed that it's invasive ductal carcinoma, and that's the most common type of breast cancer. And they check for different hormones, and it's estrogen positive. I was progesterone negative and HER2 negative. So then I feel like I'm telling you the story really fast, but then I get those results, and it's, what do I do now? And the nurse said to me, you need to get an oncologist and you need to get a breast surgeon. And she said, I can give you some names, but I also suggest you research as well. So I live in Tampa, where there's Moffitt Cancer Center. There's a big cancer center here. And my first job as a nurse was working at Moffitt in bone marrow transplant. I love Moffitt, but it's a behemoth to navigate. And I talked to some of my friends who worked in oncology. I talked to my old director, and we all said, what I do with my type of cancer will probably be the same protocol. And I opted to not go to Moffitt because focus on research and things like that, where if I went to what's called the Baycare system, I would most likely have the same protocol, that type of thing, and I wouldn't be so much of a number.
Sure.
So I made that choice. I remember I said I was a nurse practitioner in the past. One of my previous patients was a mammogram technician, and I had her cell phone number. She was one of the ones I had given my cell phone number to. You're very cautious with that when you're a healthcare provider. But I called her and I told her everything. And because she knows who are the oncologists, who are the breast surgeons, she gets to see it firsthand that you want to go to. And she said, take a picture of your insurance card, send me your address, I'm on it. She called and got me in with a breast surgeon the next day. I mean, did everything. You know those tedious appointments when you make a doctor appointment where you go through your insurance and everything. She did that, and also with the oncologist as well. So I had appointments, in less than 5 days with both of them. I'm going to take a look and see what questions you have.
Sure. So I'm actually going to go all the way back to the start of the conversation. You were running to the car, tears streaming down your face. You get to the car. What do you say, and how does your husband respond?
I just said, it's cancer. I have breast cancer. And he started crying too. And he's like, what now? And so I told him about that I would need to have a biopsy. I clicked into the medical mode because I didn't want to be this sobbing mess. And I'm like, I need to get this done. I need to get this done. That's my personality. When I have something, a challenge, something like that, I go into this mode of, let me make my list. What do I need to do? This is what I need to do to take care of this. So,
and it's a very difficult.
We call family at that time too. So.
And it's a very, I can imagine that it's easy to slip into that mode when it's not you yourself, because you can be very clinical with someone else. But if it's you, or maybe with a family member, it might have been more difficult. So in that moment, it sounds like you were able to transition as a coping mechanism. You mentioned you reached out to family. How did they respond?
There were a lot of tears and disbelief. Is how did this happen? Jumping back to my husband, he did say, because it was prior to the biopsy, he's probably wrong. I'm sure it's something else. He's probably wrong, which is normal to think that way. I even had transient thoughts of that, even though in my gut I knew it was cancer.
Okay. And so you reached out to your family, you went into clinical mode, and it sounds like you went into action, which is fantastic. And you were able to get many things done in a very short period of time. What is your advice to individuals who may not understand the system nor the ways to navigate it in the way that you clearly were able to do in a very rapid way?
See, I had the advantage of having the clinical background. You're right, and I think we have to be our own advocate. When you call to make that first appointment, don't accept the appointment that's 3 weeks later. Be very clear. I've been diagnosed with whatever the disease is. I've been diagnosed with this. I need to be seen as soon as possible. And to give pushback. It's hard sometimes, but we've got to advocate for ourselves. The internet's a wonderful thing, but I caution. You know, you can get into a lot of pages and people giving opinions that may not be qualified, but that's a tough one, Manny, because with breast cancer, there's certain things, it's what I know that you need to do, but someone who doesn't have that experience, it's reaching out to someone that does. A lot of the systems have what's called a nurse navigator, and they're wonderful. They, just like it sounds, they help you navigate the waters of what you're dealing with. You know, you've done this, you need to do this. Okay, next step is this. So I think the nurse navigators are a great resource.
That's fantastic, and certainly great advice for folks who they're emotionally processing. They might not have the training or the background or the familiarity with the system. Maybe they haven't connected with the system in the ways that you have. As a clinician, you bring this such a great perspective to the journey. When you encounter individuals who have something severe, what is the flexibility that the system has to make it a priority? And can you speak to that ability for, because the first answer a person might get is exactly that. No, it's 3-4 weeks out. What is your understanding of the reality? Is there typically more flexibility there?
I look at it as, when you go to a hotel and they tell you we're completely booked, or the restaurant says we don't have any more tables, there's always room for one more. It's been my experience. When we were just talking about this, I started to think other options you can do is your primary care can be a big help with this. I had several instances where patients would say, I can't get in. This is what happened. And I would call and explain who I was. This is the situation. And like I said, there's always that room to sneak one more in. And you know what? If you do find that you're just getting pushed back, that's not the provider for you. You're right. You want to look at the next one.
Great. And so you schedule the biopsy. And what does the biopsy confirm or tell you?
So it confirmed that I did have invasive ductal carcinoma, estrogen receptor positive. So that helps with the treatment plan as far as what I need: chemotherapy, radiation, surgery. So had. It's important for me to say had and not have a positive lymph node in the armpit. So it gave that information. So it's a great starting point for the breast surgeon and the oncologist when developing the plan.
And does that tell you the staging of the tumor at all? And did they tell you what that was?
It did. It's 2B, and the reason for that was because of the lymph node involvement. So,
okay. Yep. And what had you known about stage 2B going into that, or what did the doctor explain?
It's funny. Even though I had worked in oncology years before, I had to brush up on that. So some of the sites are breastcancer.org, cancer.org, that are reputable sites that I looked, and I talked to my friends as well who were still working in oncology. So you always hear, oh, good, they caught it early, that kind of thing. We always hear that phrase, which certainly I was so relieved to hear that it was isolated and not in any other organs. It had not metastasized, but it was in a lymph node. So when we had conversations, the oncologist in particular, it was determining whether or not I needed chemotherapy and radiation. And they did a test called MammoPrint that looks at the risk of recurrence and if you would benefit from chemotherapy, and it was determined that I needed chemotherapy.
And I imagine the quality of your conversations with your oncologist and with your surgeon were pretty high quality in terms of the information that they were able to provide you and the questions that you were able to ask. Were you able to ask about the mammo print? Was that something that the doctor suggested? Or was it, would you characterize it as a give and take where you were asking the right questions so they gave the right answers? How would you describe it?
He brought it up, and I knew a little bit about it just because Oncotype DX is the one that's used in the majority of the situations. But I was able to ask him about evidence, the study data to support using it. And he is actually an investigator in one of their studies right now. This is the breast surgeon. And that I will tell you, though, when you started getting in the pretty complex scientific conversation about why you use it, it was deeper than I had that background understanding, and I had to say, no, stop, let's break it down a bit more. I was so fortunate. I don't know if they said it aside, but this appointment was 45 minutes, and he was not rushed. He didn't do that stand up, walk towards the door thing that sometimes you see. No.
Great, great. And so the mammo print helps with what exactly?
It's the way I understand it is if you are a candidate for chemotherapy, because one of the things that's been found is sometimes chemotherapy is used in situations when it may be too much. It's not needed. So it's saying, yes, this individual would benefit from chemotherapy. And so then it was determined that I would do neoadjuvant, which means having the chemo prior, because I was a surgical candidate as well, having the chemotherapy prior to the surgery. And there's two things. You want to shrink the tumor, but also see what that response is. And the hope is that you have a complete response where it gets rid of the tumor completely.
Great. And so you were told that you needed chemotherapy. That is a tough thing to hear, and you know what chemotherapy does. How would you describe how you process that information, and did you know what to expect?
So the oncologist also, he spent an hour with me, and same kind of thing where the appointment was for me, but I can still remember he had lots of printouts with different chemo, because there's a couple of different protocols you can do for the type of breast cancer I have. We talked about the different side effects and opted for adriamycin, Cytoxan, and Taxol. While he was going through it, he hit the highlights of some of the side effects, and I had given those three drugs quite a bit when I worked at Moffitt. And while he's talking, it was almost like time was standing still. I was having visions of nausea, vomiting, because I can remember one patient in particular. She woke up one morning and she was eating her breakfast. Her hair was just falling into her food, and how upset she was. And it was weird, Manny. Everything was going slow, and I was thinking of all of this. And I thought, but this is what I have to do to save my life. I need to have this chemo. We talked about having a port placed that's a way for the chemotherapy to be infused in a large vessel or in the chest. It's a portacath is what it's called. But we decided on the protocol, and that was based on the data. It was very close, and I can't recall it, but as far as survival and as far as, eradicating the tumor, it was very close, and it had to do with side effects was the reason I opted for what I went with. But it was, remember how I told you I was a checklist, I got to get this done kind of thing? I started to get into that mode of, I'm the patient. This is real. That's when reality really starts to kick in.
Sure. And so, how long was the course of the adriamycin Taxol?
It was 5 months.
5 months.
Yeah.
And you had the port put in. What was the schedule like? Was it manageable for you? Did your husband help with the appointments? And then, how was the tolerability for you?
Well, I was working full time at that time, and isn't it funny? I'm just thinking it was a year ago, and I'm trying to remember the adriamycin Cytoxan was either every 2 weeks or every 3 weeks. I've already forgotten how often, but I want to say every 2 weeks. That was the much tougher. They were given together, much tougher than Taxol, but drugs they do now for nausea and vomiting are amazing compared to when I worked at Moffitt in the 90s. I had nausea, but not to the degree that I remember. Remember when I had those flashbacks to when I worked there. So that was pretty good. Incredible heartburn, just horrible GERD, a gastroesophageal reflux feeling. I didn't want to eat anything. I lost 25 pounds, which I don't want to make light of it and say it was welcome, but that really illustrates how much I wasn't eating, just exhausted. And I talked to my director and I said to her, I'm trying to push through this. And she's like, Amy, do what you've got to do. So I went on leave at that time. When I started the Taxol, that was weekly. Let me jump back. When I started the chemo, I knew that I was going to lose my hair. There's lots of different ways to approach that, and it's individual. I decided to go ahead and shave it because I didn't want to have that waking up in the morning with the big pieces of hair on my pillow and that type of thing. I wanted to choose that. So what we opted to do, my husband offered to shave it, and I thought, I'm very protective of him. I don't know if you've noticed this. I thought that may be hard for him to do. So my sister's hairdresser came out to the house. We all had masks on, and he shaved my hair outside. And afterwards, I'm feeling it, and I thought, this is pretty cool. And I look at my sister and my husband, and they've got tears rolling down their face. I can't wait to run in and look at myself and say, I look kind of punk, So that was part of it. There's that physical part, but there's also what you're presenting to the world. So when I go to the store, which wasn't very often, but go to the grocery store, people would look at you, and I would have rather, there'd be looks of pity or curiosity, a child saying, why does that lady have no hair, that type of thing. So it's so much, there's that physical part that you're dealing with. It's when you look in the mirror, I would say to my husband, when I'd walk up the stairs, you see your shadow in the light at night, and I'd see this head without hair, and it's just, you're reminded of it. It's on your mind constantly.
So it's a very tough time. And I love that sentiment that you shared where you said you're protective of your husband. So you're going through this very difficult time and your thoughts go to him and how he's managing through. And that's wonderful, right? It shows your relationship coming through, but also your role within the family, which sounds to me that, maybe there's an element there that you still want to be there for your family, even though you are going through what you're going through.
You know what else, though, that I've learned? That there is a control thing, too. I found when Frank would say to me, can I make you some toast? Buttered noodles, believe it or not, were something that I would crave, that I could eat, that I could tolerate. I would go in the kitchen and start to do it myself, and he'd say, no, I'm going to do that for you. There's such a thing with the independence being lost. And it took a lot for me to say, okay, or to even say, can you get me this, please? That I was so used to doing things myself, and that was a real learning. But a lot of control, it's that loss of control.
So how would you recommend folks navigate that? Difficult to ask for help sometimes.
I think it's having conversations. Frank and I had conversations about it, and he said, look, you're going through this. I want to help you. This is how I can support you. And he even explained that in doing things for me, making me food or whatever it was, helped him feel like he was contributing. Otherwise, he felt helpless. So I think that a lot of it has to do with communication and realizing that this is a time I truly need help. I need to take care of myself.
Wow. No, that's a beautiful illustration of your marriage and relationship as well. So you go through the neoadjuvant chemotherapy, and then there's the surgery. How does that go?
So the chemo, I was diagnosed in April, chemo finished in September, and then I had the surgery. They usually wait about 6 weeks later in October. And I had a really hard time with that. And it wasn't, there's talk about grieving for losing your breasts and that type of thing. It's the surgery. I don't want to scare anybody. For me, not the surgery itself, but the recovery was very challenging. You have a lot of drains put in to collect fluid. So I had 4 drains. They prepare you for it, but it's not until you're actually experiencing it. The pain wasn't bad. I was able to manage the pain with the medication they gave me, but you have these drains that you safety pin to your shirt, and you have to sleep sitting upright, and you're exhausted. And that was another time where, because I went back and forth forth with the accepting help, that was one where I really had to say to myself, Amy, you need to accept help. Even you empty the drains and record the amount of drainage, report that to your surgeon. My husband was even like, let me do that for you. And it's almost like I felt like it was a personal thing for me to care for all that. And he did the dressings too, which is, that's something, if something brings you close together, it's changing dressings after a mastectomy. I mean, we've said that this has brought us even together, even closer than we ever were. We were always that couple that, you ever hear the ones say, we never fight. We don't really fight that much. When we do, we get it over with, but it brought us together closer. But the surgery was tough. And then what happens for me, I chose to do reconstruction. And briefly, what that involves is you have the mastectomy. I had bilateral. I had both breasts removed. I opted, even though the cancer was in just the left, to do the right as well, because I was concerned with recurrence on the right side, and my surgeon supported that decision. But with reconstruction, they put in what's called tissue expanders, and it's just like it sounds. It's almost like a placeholder for when they put the implants in later. I call them Tupperware bowls, so these hard, plastic domes that you go every week and have saline injected to enlarge them to accommodate the implants later. It was a lot. That's weekly going to the plastic surgeon's office. It's painful. It does hurt. Not the process of inflating it, but once you have that skin stretched, it can be painful. So that to me, the chemo, believe it or not, I felt was easier to tolerate. And this is for me personally, than after the surgery and the expanders and having those, having the saline injected to the expanders.
Sure.
So that was a couple of months doing that. And then I had radiation as well. And that was because of the lymph node involvement. And the radiation started in January. I had the company I'd worked for, I was on medical leave. The company I worked for was acquired by another company. So there was a transition to, I was on leave, this is happening, I had to have new insurance. And so there was some holdups with insurance. So my radiation didn't start until January. So it was quite a long process when you think about when I was diagnosed and getting all these things done. I was still checking my list off though, Manny. Getting this done.
Sure. And so the surgery itself, it sounds like it went through without complication.
Right.
And it was the reconstruction that caused a bit of pain. Were you given pain medication to manage through that? And were there any things that helped you cope through that you would recommend to others?
You're given Vicodin, which I only used for a few days because, the addictive risk with that, and also it makes you feel loopy. But I used ibuprofen with the actual expansion that was done. I found that I would start to dread the appointments going to have it done, but then I readjusted. I said to myself, you're getting towards this goal here. This is something you need to do. It's like the chemo. I needed to do it to save my life, to shrink the tumor. With this, I opted for reconstruction. So these are steps I need to take. So I would readjust my thinking. I do a lot of that. If I find I'm going down a negative road, I stop and regroup and go the other way.
Sure. Could you talk about the radiation and how you managed through and what side effects you had and that kind of thing?
That was one of the things I was concerned about, and I had a lot of conversations. Do I need to have this with my oncologist? Because it was one lymph node, but I looked at different studies. I was reading up on it, and it looked like, yes, you do need radiation to prevent recurrence. And when I talked with my oncologist and the radiation oncologist, they explained to me that this is something that really, one of the analogies that the oncologist used was you've had the chemo, you've had the surgery, the radiation just gets in there and gets rid of any little something that's left, is the way that they described it, which isn't very scientific, but the oncologist really said to me, Amy, you need to have this done. I had read about they're being fatigued with it. And one of the big things is what happens locally at the site where that's being radiated, where you hear about radiation burns and the pain from just the way the skin and the tissue reacts. I was really fortunate. They gave me different creams to use, and I really had just a little bit of redness, so I was really fortunate. I did feel a bit tired, but nothing like with the chemo. So if I had to rate all three things, the radiation was not that challenging. When you look at the reconstruction, though, one of the concerns with reconstruction with radiation is radiation can cause thickening of the tissue. And so that can make it more challenging for the plastic surgeon. That's who does the reconstruction when they go back in and put the implants in. From an aesthetic part and surgical outcomes, you're more concerned with someone who's had radiation.
Sure. And how long did the radiation last, and were you able to manage through?
Yeah, it lasted for, I had it for 4 weeks. There were two places that I could have gone, and the one that I opted to go to because of the radiation oncologist, another one, remember I had my group of people that helped me choose my providers, was about 40 minutes away with traffic. And every day I would go, you go every day, Monday to Friday. I would go, but the actual radiation itself took a little bit less than 2 minutes. I had it down in my mind. A lot of it's positioning you. If you've ever seen the pictures of the large machine that rotates around the patient on the table, getting you in the right position takes longer than the actual radiation. And I would play games where I would go through all the states alphabetically, and I knew if I got through all the states alphabetically, then I was able to go through again about halfway, and I would be done. That's how long it took. And I would always get messed up in the M's, but towards the end there, I had every state.
Fantastic.
But tolerating it really was manageable with the radiation. And you know what else? That was towards the, I don't want to say the end. I feel like there's never an end to this.
True.
But it was getting through those treatments, and then all I would have was that final reconstruction. And I felt like there was a finish line that I was getting closer to.
Sure, and that's motivating that there was going to be an end to it, at least an end of sorts, as you would say. So it's been quite the journey, right? From neoadjuvant chemo through to your surgery itself, the reconstruction, the radiation. Are we at the point where we fast forward to the impact and the changes that you've made to your life as a result? Or are there other things that we should talk about?
You know, one thing I think about going through all that, well, the working part of it is I was so fortunate I had a very supportive director. But what happened during that process is I was actually laid off.
Oh, wow.
So, yeah, and believe it or not, I still had 2 drains in when I had the call from Human Resources when they laid me off. But things always, I don't want to have the cliche, but things always work out. That's one of the things I say to myself. Things are always working out for me because they ultimately do. Sometimes when you're in the thick of it, it doesn't seem like it. But when it came to all that, I started radiation, and I'd received a severance. I started radiation, and during that time, I thought, I need to start looking for something else. Now it was the new year because you don't want to look around Christmas time. I was starting to feel better, so I started on a job search. And one of the things, I had lost my hair, so I wore a wig. I was really concerned in the job search to have to explain why I was off from work for a chunk of time. I struggled with, do I share that with the prospective employer? I felt like it's private. That was tough with that. I wore my wig. I did my interviews. And I ultimately got a position. That's the unique thing with COVID. So many of us are being hired via Zoom or via Teams and that type of thing. So that was part of it, is getting back into that workforce, because I felt like I had a loss of confidence, if that's the right word I'm looking for, because the rug's been pulled out from under you, and this has happened, and what else is going to happen? And you're almost looking over your shoulder. And I hadn't worked for a while, and I felt like I had been in that sick role, and getting back out there and transitioning to working and not being all about disappointment. Got to get here and do this. Got to do that. Does that make sense?
No, it's a very human thing, and a lot of folks will have that exact same scenario. Either they choose to quit, right, because of the situation they're in, or things happen. I've spoken to folks where the pandemic has caused a lot of things to happen for folks on the job front, and we all have those concerns, particularly with a pause. How do you explain it? Do you explain it? How much do you reveal? Because income is important, right? We all need to support our families. And so there's that added layer of stress, not only from what you're going through with your health, but also with, wanting to be able to continue to provide for the family, to ensure that you're taken care of, that your family is taken care of. I completely understand and can understand that would be difficult. But you were able to get a new job, and did you end up sharing during the process, or was it after the process and that kind of thing?
I work for a wonderful company, and what happened one day, I was on a Zoom call just like this with the camera with someone I work with. His name is Jonas, and I dropped my pen, and I had my wig on, and I bent down, and I felt the wig kind of go sideways, almost like Cruella de Vil or something. I felt like it goes sideways, and I thought, when I sit back up, I'm wondering if it's going to be, tilted. You kind of look at yourself in how you look, and it was okay. And he started to tell me how he'd hired somebody new who had been treated for pancreatic cancer, and how amazing this gentleman's story was. And I thought, I'm gonna tell him. And I said, I want to tell you about me. And I told him, and I said, one thing I'd love to do is stop wearing this wig, because it's hot, it's itchy. I'm in Florida, but underneath I had these little gray hairs. I was never gray before. I used to color my hair, but I wasn't 100% gray. And he said, you know what, Amy? And ironically, I work for a company that develops therapies in the oncology space. But he said that people are going to understand. If you want to stop wearing the wig, you just tell your story. They'll be like, okay, and they'll be done with it. We're going to move on with other stuff. We're not so worried about your hair and everything. I had worried during the interview process about ageism, with just because my hair is 100% gray, and I'm getting offered senior citizen discounts now, which drives me crazy. But I'm not, I don't consider myself to be a senior. But so what I did is I let people know, hey, this is what we have a messaging system. I would tell people before I got a call with them, I'm going to look a little bit different, and everybody was so nice and so wonderful about it. So, I didn't say anything during the interview process, so I opted not to do that.
Sure. And certainly for the many reasons that we talked about, that makes perfect sense. And that sounds like such a wonderful conversation to have had, where you and it's kind of the reason for Healthful Heroes to exist. There is a bit of liberation that we get when we can be ourselves in everything that we have, whether it's a health condition or anything else that we want to bring to work, to be ourselves, and that you've found a way to be able to do that with your colleagues. There's some element there of humanity that I first of all, congratulations that you've been able to do that, because there's a comfort there in knowing that you don't have to hide yourself.
You're absolutely right. Every morning when I would get ready, I would put the wig on, and I never felt comfortable in it. So the whole day there was that certain kind of apprehension. It was very, very freeing to get rid of it.
Wow, no, thank you for sharing that part of the journey, because it's an important reason. Life continues despite the health conditions that we're dealing with. And, going through what you went through with a company getting acquired, subsequent layoffs, etc. Very difficult, hard times emotionally for the family, added uncertainty to the entire journey. I can guarantee that there will be others out there who will experience similar things. That tension between needing to take care of yourself, but life demanding that you pay attention to other things is something that I imagine is quite common. So, how are you doing today?
I'm doing great. So I had the last part of my reconstruction back in August where they removed the expanders and put in implants. And I had a follow-up appointment, my last one with the plastic surgeon a week ago, and I don't need to see her for a year. I've talked to my friends and my family about transitioning from different kind of roles where I was in a sick role, and now I feel like I'm in a wellness role where it's not on my mind all the time. I'm not rushing to appointments. I don't have the expanders where you could feel them all the time. I don't have that feeling anymore. I now see the oncologist once every 6 months. I get an infusion called Zometa, which is to prevent osteoporosis that can be caused by a hormone blocker that I take every day for the next 5 years. So breast surgeon, I don't see for once a year. So it's a completely different feeling when I'm not constantly looking in my calendar. What appointment do I have next? It can be, I'm trying to think how to articulate it. There's times where I think, boy, I haven't thought about having breast cancer all day today, where it used to be on my mind constantly. And as the days go on, it's less and less and less.
That is so wonderful to hear that you've transitioned, and that transition in and of itself is something that others diagnosed with cancer may be able to look forward to. And clearly it was a difficult journey, right? Chemotherapy is absolutely tough. The surgery, the radiation, the reconstruction, these are not easy things by any measure. Come to the other side, and you are now starting to get to maybe life is never the same, but at least you are starting to reclaim a bit more of that life that you once had. How would you say you are mentally prepared for the future at this point in your life? What are your expectations? Do you have any expectations with respect to the cancer and recurrence? Does that come into your mind at all?
One of the things with breast cancer that frustrates me is when it comes to surveillance, or how do your healthcare providers monitor and make sure that you don't have recurrence. And with breast cancer, when it metastasizes or goes to other parts of the body, it's known that it's the brain. I have to think about your brain, bone, liver, lungs. Those are the places that typically it will go to. We always think when somebody's had cancer that they'll have scans or blood tests or things like that. In breast cancer, the consensus is that there's not benefit in doing repeat, say, CAT scans of the abdomen or of the chest or bone scans, that if you kept doing these tests, that you're not going to increase survival. It's a mouthful, but there are groups of experts that come together and decide on these guidelines. And the guidelines now, you do not do any type of scans, blood test. What happens is if, say, I was to have really bad headache or if I had bone pain, then you have scans. That's very frustrating to me. That's the way it is. It has to do based on data, but insurance has a lot to do with it and cost, that type of thing. So that's frustrating to me. It is in the back of my mind. What if it comes back? We watch the 6:30 news every night, and every commercial is about some type of stage 4 breast cancer, if you've had metastasis, that type of thing. It is in the back of my mind, and I would be fibbing if I said I don't sometimes really get focused on it. And that's where, when I told you before, that I stop and say to myself, I got to readjust the way the mind's working here. I prepare myself. I did chemo, surgery, radiation. I lost those 25 pounds with chemo, and I've kept it off. That be a risk. I'm always working on diet. I love sugar, but I always working on diet. I do Pilates twice a week. We walk every single day. It's in my mind, but it's really am cognizant of making sure that I just don't go down that road and get, in that mindset. It's going to come. It's going to come. I say to myself, I've taken care of all these different things I need to, and I am a healthy place.
That's wonderful. And were these things, the diet, the Pilates, et cetera, things you were doing before the diagnosis, or were these things that you picked up as a result?
It's funny that you asked that. I did Pilates once or twice a week, but there are times where if I was too busy, in my mind, I'm too busy, cancel or reschedule. I do not cancel or reschedule at all. I say to myself, this is something I need to do. It's not a nice to do, it's I need to do. And my Pilates instructor, who's also a friend, has even commented, she's like, you really stick with it. And that's it's different than I was before, because I was work. I used to fly all the time. I was, the titanium Marriott, the, Platinum Delta, all the different frequent flyers. And now I'm really focused on taking care of myself.
And that's great to hear. And your family appreciates you taking care of yourself as well, I'm sure. Any final advice that you have for folks encountering a difficult journey with cancer or otherwise? What words do you have for them? What motivation do you have for them?
I think when you had asked me about did I do the Pilates and the diet and everything before, one thing I'd like to share is I had talked about control. I was really big prior to my diagnosis in trying to control everything. I wanted everything to be a specific way. A positive that's come out of this is just to know I can only control what I control. This happened. I had this diagnosis. I can't beat myself up or try to figure out why did it happen, but I certainly can make the best choices for me on my treatment and how I approach each day. So my advice is to really focus on that end goal, which is getting well. Keep positive people around you. Sadly, when we're diagnosed with something like this, a lot of people don't know how to respond to you. I've had some friends that really stepped up. I had some that were so uncomfortable talking to me that they pulled away, which can be hurtful, but that's how they deal with it. But keeping those positive people in your life. I'm going to pause, Manny, because I went off on a tangent that wasn't what you asked me. Tell me again what I.
No. I think you were answering it perfectly, which is the advice that you have for others encountering a challenging journey. Yeah, that was it. And I think you answered it perfectly. I reflect, right? You've worked in healthcare your entire life. You have helped patients with cancer. You have now been a patient with cancer. How do you think about your life and your role today, and has it changed the way you view your role today now that you've had this experience?
I think that I did bone marrow transplant. I was also a recovery room nurse at Moffitt at the Cancer Center, and there were times you'd have patients that went into surgery and they didn't know if they were going to have a lumpectomy, taking out a little bit, where the tumor is, versus a mastectomy. And you would be the face that told them they had the mastectomy. And a lot of the nurses I worked with would always say, oh, give that patient to Amy. She does good with that. Give that patient to Amy, which in retrospect, I think that was a compliment that they were saying that. But I felt like the way I know I did, I was very kind in how I handled that type of situation. And it's my hope that I felt like that's the way I gave back to others, because I also was that way with patients when I was working as a nurse practitioner. But as far as changing my way, I always had that. My father was a doctor, my mom was a nurse. I come from a family with a lot of medical background. I feel like what I've gone through has even added to that even more, being empathetic of what others are going through. It may have been in the past, I just had a revelation, it was more sympathetic, which is different than being empathetic, but where I can really step back and say, okay, this is what somebody's going through. I'm much more, choosing my words here, I was going to say tolerant. I'm much more understanding when I interact with people that may not be having a great day. They may be short, whether it's the cashier at Target or one of my friends or my husband, that I really step back now and say, okay, everybody's going through different things, not to personalize or judge. That's another big thing.
Wow. Wow. No, that's fantastic. And have you encountered healthcare providers that empathy is not there? And certainly we don't wish every healthcare provider to experience the illnesses that they are charged with caring, the folks that they're charged with caring for. Is there any message that you would deliver to healthcare providers as they engage with patients that you feel that you have now a pretty unique perspective?
You know, it's funny. I personally, if I have, it's been years ago but where my oncologist office, I'll see there's another oncologist in the group, and I'll see how he interacts with people out in the hallway. First of all, he's talking to them about what's going on with them in the hallway, which you shouldn't be doing. But I watch him sometimes, and I just, you know, when I hear how he's talking to them, very dismissive. Where my oncologist, he's a hugger, even during COVID, where sometimes I'm like, please don't, but he, you know, he's always so genuine and warm. I think that healthcare providers need to not lose sight of why they went into medicine, that we're here for the patient. It's not just a matter of, I've got 20 patients I'm seeing today, let me get through this, got to get through my charting, you know, that there are a number. I think it's really remembering why you're here and that each person is an individual.
Oh, that's a great sentiment. And certainly I am hopeful as well that providers will view this video and take a bit from your journey. You know, that difference between sympathy and empathy is an important one. It allows you to journey into the other person's experience a bit more fully and to have that grace as you described it. And I know you said the word tolerance, and it's actually a really good word. We all have to have more tolerance and grace with others, because you're absolutely right. Everyone's going through their own journey, and that's a lot of the reason why we have these conversations for Healthful Heroes. Is there's a bit of healing in the conversation as you share your journey, as others listen to your journey. That is the hope, that we help each other out. So, Amy, I wanted to thank you so much for taking the time today to share your journey. I've learned a great deal about who you are as a person, as well as what you've been through with your journey. And I'm absolutely certain others will be helped tremendously by the vulnerability, but also the tremendous strength that you have just shared. So thank you so much. I look forward to staying in touch over time, of course. And wherever the journey takes you, I wish you well and continued health for the future. So thank you, Amy.
Thank you, Manny.